Good morning, everyone. So today I want to talk about a couple of different things. I'm not really sure what this would go under. This is just from my observation at my field placement. I actually don't have anything to do with this case, but I am privy to the information due to the rounds meetings that I participate in every morning. So I'm going to give you a little bit of a background on this particular patient. And this particular patient is assigned a social worker. There are currently only 2 social workers that work on the geropsych unit, and that unit houses 20 beds. So each social worker can have up to 10 patients. This particular patient, I believe I had mentioned him in a previous video, but he is a younger gentleman. He's only 56 years old, and he is on our unit with end-stage Alzheimer's. And again, he's 56, so this is pretty young. This is actually one of the youngest patients that we've had on the floor. Last month we did have a 55-year-old Alzheimer's patient who just recently passed away. This particular gentleman came into us due to having some aggressive behaviors at home. While he's been on the floor, his aggressive behaviors have increased drastically, but this is also, I need you to understand that he's at end-stage Alzheimer's, so the progression of the disease is quite fast at this particular point. So this gentleman came in semi with it, semi not. And to give you a little bit of background on him, he just lost his wife about 6 months ago to cancer, and they have a 15-year-old son. The patient's DPOA, who's currently responsible for him, is his sister. So this gentleman has had multiple violent outbursts, aggression issues. Quite a few staff members have gotten hurt in regards to dealing with him. He basically came in when you have a patient that's admitted to the geropsych unit, it's not only for their behavior issues, their mood disorders, that type of thing, but it's also because they're having their medications kind of altered a little bit to see which way is going to be best for them, and it's better that they're in the hospital while that happens so the doctors can monitor how their increase or decrease of a certain medication is affecting the patient. So this is why this gentleman was brought into us. Also, he couldn't be handled at home anymore, and he was put into an assisted living facility that could no longer handle the behaviors that he was exhibiting. And since he's been on our floor, his behaviors have gotten worse, as well as the progression of his disease. So this gentleman who came in and was walking and talking is now no longer talking. He's still walking, but his gait is very unsteady. He has to have what they call a one-to-one 24/7. He is usually in 4-point leather restraints at least once or twice a day due to his violent outburst. And like I said, he has hurt several staff members. So now, instead of having a staff member do his one-to-one, we have one of the security guards that works for the hospital sits with him. And when he has to have care done, there's about maybe anywhere between 4 to 6 staff members that go in to help provide care for this gentleman, such as his washing up and changing and whatnot, because now this gentleman is incontinent and needs to be cleaned up fairly often. The other day I was a part of what they call a code gray, which is a violent aggressive patient, and it took 9 of us to hold him and strap him down to the bed. That's how strong this gentleman is. Even though in his progressed state with his disease, you would think that he wouldn't be, but he still is pretty strong. But we're at the point now where he is almost like a zombie walking down the hallway. His eyes are closed. He walks into walls. He tries to urinate in the hallway, defecate on the tables in the living area. He just doesn't know, obviously, what he's doing anymore. So the issue that I'm going to be bringing up is probably, I don't know, I guess would be boundaries, limit setting. I'm not really sure, and I'm not going to really have a specific question for you at the end of this, but I kind of want to get your thoughts and opinions on this situation as to how it's been handled, mainly by the social worker, because that's basically what I've been observing. And this social worker has no psych experience at all whatsoever and has only been with the hospital for 2 years. I believe this social worker is a new grad as of, I think, 3 years ago, but no psych experience at all whatsoever. So the patient has a very difficult, this video is going to be a little long, I apologize. The patient has a very difficult situation in regards to his family. His sister is his DPOA, and his sister is somebody who is constantly calling the hospital. Now, in my opinion, if there were clear boundaries set with the sister as to what the policies are as far as obtaining medical records and getting second opinions and other consults, I don't think the situation would have progressed as much as it has as of right now. This gentleman has been with us for 63 days. And I have actually dealt with this sister, not during my field placement, but as a nurse on the night shift, copying this gentleman's chart, which I thought was highly irregular and not something that we normally do. This is something that medical records is supposed to do due to HIPAA law. Even though she is DPOA, there are certain things that she cannot have that are in the chart. So this sister has gone from, she's very aggressive is what I'm saying. Basically, she's very aggressive when it comes to the care of her brother, and I completely understand that. When he first came to the hospital, it was basically, I need him alive for another year. I need him alive for another year so his son does not have to grieve all over again. Now, as a human being, I think we all totally, completely understand that. I get that. But at the same time, this woman was completely uneducated in regards to the progression of an Alzheimer's diagnosis. So we've been doing a lot of changing his medication, seeing what's going to work for him, seeing what's not. Well, it's come to the point now with the sister who she calls multiple times a day, has been for the past 2 months now, multiple times a day, is very aggressive and very nasty to the staff, very disrespectful to the doctors, has gone and got a second opinion through another hospital, and is relaying information from other physicians at a different hospital who has not seen this patient as to how to treat him. Has threatened to take him out of our hospital several times, which we at this point are kind of like, fine, if that's how you feel, then maybe that's what you should do. But unfortunately, due to the state that this gentleman is in and the violence with his behavior, no other facility will take him because they're not really equipped to deal with him. He doesn't need a psych facility, so to speak. He needs to be on a geropsychiatric unit on our floor with geropsych doctors who know how to manage the progression of an end-stage Alzheimer's. And this particular sister is not accepting that his decline in behavior over the past 2 weeks is due to the progression of his disease. He has poor PO intake. He's not eating as much anymore. He is now no longer verbal. He has lost control of his bowels and his bladder, and he has fallen several times due to his systems are just shutting down, and she is just refusing to believe that. So she calls constantly. Well, the social worker that is working on this particular case has kind of been very passive aggressive with her, and to a certain point I understand the social worker who is working with her. I understand her, what's the word I'm looking for? I understand why she's kind of been a little passive aggressive with her, because, I mean, this is a very hard thing for a family to watch, especially a loved one to go through. But at the same time, I think it's the duty of that social worker to say, you know, at this particular point, we really need to look at quality of life, and let's have a family meeting with you, with the doctor, and let's discuss the progression of his disease. That has not been done. And as I said, the patient has been here for over 60 days. So nothing like that has happened. And even on the doctor's part, they have not offered to do that particular type of meeting, which is very surprising to me, because there are a lot of cases that we deal with when we have a patient that comes in and they decline pretty rapidly. You know, it's almost instantaneous. Okay, let's set up a family meeting. Let's discuss our options here and see where the family wants to go, and make sure that we're all on the same page. So yesterday in rounds, they discussed setting up a family meeting. The family meeting is today at 11 o'clock, and unfortunately I'm not there today to find out the results of what this meeting is. I will find out tomorrow, and hopefully we'll be able to update on this situation, because it's been a pretty, I'm really not giving it any justice in this video, but it's been a pretty hard thing to watch, and it's been something that's been very frustrating to me as I sit here and I watch a social worker who has had no psych experience at all whatsoever, and has had basically no geriatric experience in regards to certain diseases and mood disorders, and giving advice to these family members, which I think, to me, is way out of scope of practice. I think it's unethical. I think that if there is a patient's family member, such as this particular sister, who is a healthcare attorney, who should probably know the progression of the disease. I think at this particular point, she's just refusing to accept that her brother is dying, and is kind of grasping at whatever she possibly can. But I also feel that it's the duty of the social worker to say, this is how it is. I can help you through this. But at the same time, not give somebody medical advice. She's not a doctor. And that was something that was overheard by me and by my field instructor as well, which I believe that was going to be addressed as well, because it's not the first time that she has done such a thing. And that has caused some issues in the past, from my understanding. I have heard her several times in my field placement, speaking to patients' families, and answering clinical questions that are specifically meant for their doctor to answer. Now, there are certain things that we have to do on the geropsych floor that do have some clinical aspects to it. But if it's something that goes beyond what I can read directly from the chart or whatnot, the question should then be addressed to the doctor and not to me. I'm not a doctor. I do have healthcare experience, but even then, that doesn't justify me being able to answer clinical questions that should be expressed from the doctor. So this particular social worker, I feel, has kind of dropped the ball, so to speak, in regards to this family. I think that there has been some prolonged suffering, and who knows, maybe even if from the very beginning they sat down with this sister and educated her on the progression of her brother's disease, that maybe this all still would happen, and she would still be the way that she is now with staff and doctors. We have 3 geropsych doctors on our floor. She's fired 2 of them. She's down to 1. And that's who she's meeting with today. All because she's not getting what she feels that she wants. And she wants her brother to be fixed, and that's not going to happen. And that has been explained to her, but I think it's been explained to her too late. I think that as we've gone on over these past several weeks, that we have gone from wanting her brother to live 5 to 10 years to, okay, just give me another year, to I'm getting a second opinion. This poor gentleman has had probably 4 different second opinions. And I completely get that. Like I said, this is a very difficult thing to watch, especially when they're so young. And 6 months ago, they were walking around and, being able to have a conversation with you, and now he can no longer do that. So I think that if there were some boundaries or some limits set as to how the patient's sister behaves and how she treats the staff, probably would have been more beneficial in this case. And now there is this huge meeting that is happening today with hospital department heads, nursing staff, physicians, social work. All of that is taking place in this meeting today in regards to this one particular patient. And the reason why there are so many participating in this meeting is because this gentleman has had some serious aggressive outbursts which is a concern for all of the staff that we have and for their safety. So it's very difficult to sometimes staff the floor. We have a lot of clinical members right now that are having babies. We are primarily a female-dominated job, so there's really not very many men that can help, except for the paramedics that are downstairs in the emergency room and whatnot. So the safety is a concern, and staffing for this gentleman has been a huge issue. So all of that is being addressed today. So I guess my issue is with the social worker, and I think the not setting limits from the very beginning as to what our policies and procedures are. I think that was totally kind of bypassed when he first came into our hospital. Also, the lack of clinical knowledge that she has in offering medical advice to this patient's family, not just his, but to others, I have a huge issue with that. So I really am hoping that gets addressed. I would never do that. I hope that nobody would ever do that, especially if it's not something that they are proficient in, because you never know if you're talking about a medication with somebody and she tells this patient's family, oh, that medication is fine, and then that patient it can just downward spiral from there. So this has been a pretty tough situation for me to sit and watch. It's trying to be empathetic to both the sister and the family, and I completely understand that, but it's also about showing respect too for those that are caring for your brother and trying to do what's best by him and giving him the best quality of life that we can at this particular point. And unfortunately, from my discussion with the doctor yesterday, that particular point is going to be sedating him to the point where he's going to be sleeping, and then unfortunately he will die. But that's what happens. He's got such aggressive behavior and he's restless. This gentleman does not sleep. So it's been pretty hard to watch, and it's been pretty difficult to deal with the family. And so to me, this has been quite an interesting experience to be a part of, on the outside as an observer looking in and seeing from a different perspective what could have been done differently to maybe kind of alleviate some of the stress from the family and kind of make the staff feel a little bit more secure in what they're doing. Because at this particular point, everybody is walking on eggshells around this woman and afraid that, she's going to come in and yell and do whatever. And so I think that setting boundaries and limits is from the very beginning is very, very important. And this is a case where it should have been done from the very beginning to maybe avoid a lot of the issues that are going on at the moment. And I am so sorry that I am way over. But like I said, I don't really have a specific question for all of you. I think this had been something that has kind of been very frustrating to me. And I kind of have been putting it off and off about talking about it up until yesterday, and decided that maybe I should get everybody else's thoughts and opinions on the situation. I know it seems all scattered, and I apologize for that, and I really didn't do this any justice by talking, but I could talk about this case for hours and hours on end. So just, any thoughts and opinions that you might have in regards to whether you believe that this social worker should have set boundaries from the very beginning, as well as a social worker's scope of practice and what you feel that might be in regards to the code of ethics, because I feel that she has violated a couple of those in regards to talking to patients about something that she's not really very proficient in. So I hope you all are having a great week. And again, I apologize for this 20-minute video. I will talk to you all soon. Thank you.